The honourable member for Dartmouth North.
Madam Speaker, my question is also for the Minister of Health and Wellness. This week alone, there have been announcements for emergency room closures at Fisherman's Memorial Hospital, North Cumberland Memorial Hospital, All Saints Spring Hill Hospital, Queen's General Hospital, Eastern Memorial Hospital, Digby General Hospital, Glace Bay Hospital, and Strait Richmond Hospital. Does the minister find it acceptable that that Nova Scotians in these communities are regularly left without an open emergency room in their area?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker, and I want to thank the member for the question. I will say, as I've said a few minutes earlier, the biggest challenges that we're facing are our capacity in terms of beds, but also in terms of our healthcare workforce. So that we know, particularly, there is a nursing shortage across this province, and we've been working very, very hard. We've increased the number of seats. We're working with the College of Registered Nurses to bring in internationally educated nurses. We're doing a very intentional program in order to train and bring nurses into our healthcare system so that they're able to care for communities. We're working with people in skills, labour skills and immigration to ensure that internationally educated nurses are settled and transition to communities in a very meaningful way. It is going to take time, Madam Speaker, but certainly we have seen an incredible amount of action and investment in healthcare since we've formed government.
I recognize the honourable member for Dartmouth North.
ER closures cause crowding and long waits at regional hospitals as people travel further for care and cause massive stress and delays on paramedics. A FOIPOP filed by our caucus shows that the number of people leaving ERs without being seen continues to go up and up. It has increased again by 24% this year, and I can table that. This government promised to fix health care, but to the Nova Scotians facing emergency room closures and lengthy wait times, this just isn't the case. Yes, it takes time, but Nova Scotians can't wait any longer. When will the conditions in emergency rooms improve?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. And things are improving. So I will draw attention to the Patient Access to Care Act and the work that's done with the college. 18,000 nurses have applied to come and live in Nova Scotia. A bill, I might add, Madam Speaker, that the NDP voted against when they were on the floor of this House. So here we are, Madam Speaker. We have just settled a new contract with nurses. We've just settled a new contract with physicians. We are becoming a destination for healthcare workers around the world, as evidenced by the number of people that are coming here. So they don't want to look at the things that are going well, Madam Speaker, but I can assure you that we are investing, we are working our tails off to make sure that Nova Scotians have the health care they need and deserve. That was never a priority under the two former previous governments.